And good afternoon, everybody. I'm Ben Singer in the WSAV studios. Governor Kemp has started his 3:30 briefing a few minutes early, so we're going to join that in progress. It's the latest COVID-19 update.
Some dark days on this journey. I'm certainly encouraged by our progress in this war. Most Georgians are taking the pandemic seriously, wearing masks, practicing social distancing, and following CDC guidelines. I am confident that if we remain vigilant, we will emerge from this stronger, more united, and victorious. I'm proud to report that we're seeing record highs in testing. Thanks to the partnership with Augusta University, our university system, the private sector, as well as local public health officials, we've doubled our daily testing capacity and now have over 217,000 total tests reported to the state's website. A few weeks ago, Georgia ranked 43rd out of 54 states and territories in testing per capita. Today, we are 29th, according to the COVID-19 mapping project. Out of 23 states with more than 5 million people, we are now 12th in per capita testing. And while I'm proud of what we've accomplished, there's more that we can do to fully utilize our potential and enhance our health outcomes. As we continue to expand testing and screening for COVID-19, we must also focus on lab capacity to process the testing specimens. Right now, we have more than 60 testing sites with more supply than demand. In accordance with new CDC guidance, the Department of Public Health and district offices are now encouraging all Georgians, even if they are not experiencing symptoms, to schedule an appointment with their health care provider, local health department, or get a screening through the AU Health Express Care app. Dr. Toomey contacted local health care directors today to ensure that they are aware of this new guidance. Let's build on this momentum in the days and weeks to come. I'm also proud to report record lows in ventilator use. Through our shelter-in-place order, we were able to slow the spread and strengthen our healthcare infrastructure. Because of your patience and your compliance, we reduced the amount of stress on our hospitals as well as their employees. Through this mitigation strategy, we were also able to enhance hospital bed capacity throughout Georgia. We have had our fair share of challenges over the last several weeks, and I am proud of what we have accomplished together. When you look back on our successes in this battle against COVID-19, they all have something in common, and that is partnerships. During this pandemic, businesses, academia, government, and hard-working Georgians have come together in numerous ways to address pressing and future needs in our state. Old Fourth Ward Distillery is making thousands of gallons of hand sanitizer. Kia has donated face shields, and countless other restaurants and businesses have provided free meals to frontline healthcare workers. The Department of Economic Development now has over 130 Georgia suppliers on their list of businesses providing PPE and other equipment to help us fight this virus. On testing, CVS, Walgreens, and Walmart have partnered with the state and our university system to test well over 1,000 Georgians a day. Sandy Springs-based company Ipsum Diagnostics has been supplying us with test kits to use all across our state. Peach State Health Plan and Quest Diagnostics are also delivering thousands of tests to federally qualified health centers around the state so all Georgians have access. And Google is working around the clock with Dr. Toomey and the Department of Public Health to dramatically increase contact tracing statewide. As you can imagine, this list goes on and on. These partnerships have no doubt saved lives in every corner of our great state, and I'm very thankful. Today, I'm honored to announce another partnership with the private sector that will enhance current efforts to screen and test more Georgians. The Peach Bowl, college football's most charitable bowl organization, announced today that it will donate over $1 million to Augusta University Health System to help scale the telemedicine screening app. This is an incredibly generous gift, and we thank them for their support in our fight against COVID-19. Peach Bowl Incorporated operates the Chick-fil-A Bowl, and the organization has donated and committed more than $57 million in charity and scholarships to organizations in need. They created the Chick-fil-A kickoff game, and Peach Bowl proudly serves as the Atlanta Bowl game tradition since 1968. Peach Bowl joins the Augusta National, Tax Slayer, and many more in supporting these efforts at Georgia's Health and Sciences University. I want to personally thank my good friend Gary Stokin and the Peach Bowl for helping us to keep Georgians safe in our battle against COVID-19. And while our state has taken measured steps forward, we remain focused on protecting the most vulnerable among us. Over half of all coronavirus deaths and 20% of all cases in Georgia are related to long-term care facilities. And in Georgia, folks with underlying health conditions and the medically fragile account for nearly 2/3 of the deaths in our state. These are heartbreaking statistics, and we are doing everything in our power to keep these Georgians safe. The Georgia National Guard has been at the tip of the spear in our ongoing efforts to protect the most vulnerable among us. They've received national recognition for their incredible work, with 12 other states from Florida to Montana replicating their procedures. To date, the Guard has conducted more than 1,200 infection control missions in long-term care facilities, with 375 out of 790 facilities receiving more than one mission visit. I'd like to thank the more than 3,000 Guardsmen and women who are on the front lines, along with our first responders, our healthcare personnel, our long-term care staff, and our critical infrastructure workers. They are truly Georgia's heroes, and we cannot thank them enough for what they have been doing. Yesterday, I spoke with Center for Medicare and Medicaid Services Administrator Seema Verma about Georgia's efforts to protect these vulnerable populations. She thanked us for our strong actions to fight COVID-19 in long-term care facilities and shared what the Trump administration is doing to enhance transparency and support states on the front lines. Under the leadership of Commissioner Frank Berry and his team, the Department of Community Health has begun planning for in-person inspections of long-term care facilities to assist with infection control, monitoring, and compliance with federal and state regulations. Safety to our staff, employees, and residents remains our top priority. As such, the department will continue to work with GEMA to ensure care providers have appropriate PPE to limit potential exposure to the faculty, residents, as well as staff. To date, the Department of Community Health has deployed 125 healthcare professionals to skilled nursing facilities, with more in the pipeline. Rest assured, we will continue to do everything in our power to protect these vulnerable Georgians from harm. With record testing numbers, enhanced surge capacity, low ventilator use, and favorable data coming in from the Department of Public Health, we continue to take small, measured steps forward as a state. We want to again remind people to get important medical appointments and procedures done to maintain their health. As I have said many times before, we must protect both the lives and the livelihoods of all Georgians. There are many people today who literally cannot afford to put food on the table. We must fight for both the public and economic health of our state. As we celebrate the success of our partnerships today, Augusta University, Peach Bowl, and Georgia businesses large and small, let's remember that building a safer, stronger, healthier, and more prosperous state is a team sport. We may not agree on certain policies or belong to the same political party, but we all want the same thing: a state where families are healthy, businesses are thriving, communities are flourishing, and people are optimistic about tomorrow. We want a Georgia where your zip code doesn't define your potential, where opportunity exists for all hardworking Georgians. Now more than ever, we must put our differences aside and put Georgians first. Georgia's families, Georgia's workers, and Georgia's businesses need us. Their future and ours hangs in the balance. I'm now honored to bring up the Augusta University President, Dr. Brooks Kill, to give you an update on the great partnership that we have with Augusta University and some of their folks. So Dr. Kill, I'll turn it over to you.
Thank you very much, Governor Kemp, and let me just start off by thanking you for your strong support and unwavering leadership during this unprecedented time in our lives. Governor, we're also most grateful for your support of Augusta University, the state's only public academic medical center and home to the Medical College of Georgia. We're also a proud part of the University System of Georgia, and I want to acknowledge the great leadership of Board of Regents Chair Sachin Shalendra and Chancellor Wrigley. I also want to acknowledge the incredible support and collaboration we have received from the Georgia National Guard. Thank you, General Carden, and the men and women of the Guard, and thank you for your steadfast support and your service to our country as well as to service to Georgia. I'm incredibly proud of the extraordinary work of Augusta University, the Augusta University Health System, physicians, healthcare providers, and researchers who've been on the front lines of this battle against COVID-19. Enhancing the state's ability to test, treat, and slow the spread of this deadly virus. Their effort has been nothing short of Herculean. By leveraging our healthcare and telemedicine expertise, AU Health quickly developed and launched a mobile application that would provide unfettered access to COVID-19 screenings for all Georgians everywhere. Through the AU Health Express Care app, which can be downloaded to your smartphones, individuals can receive a virtual visit from a licensed provider 24 hours a day, 7 days a week, from the comfort of your home and at no cost to the patient. As of yesterday, more than 14,400 Georgians had received a free virtual screening through this app since its launch only a few weeks ago. Of those, 8,300 have been referred for testing. An additional 14,000 people have been serviced through the hotline and referred for testing when needed. In addition to the many Department of Public Health testing sites, and in a matter of days, in great collaboration with the Georgia National Guard, we have stood up 11 drive-through locations spread across the state, having collected approximately 20,000 specimens for testing, increasing testing at state labs more than six-fold in a matter of weeks. We have made and will continue to make important contributions to the lives and to the citizens of our great state. But Augusta University Health cannot do this alone. The state of Georgia and its Department of Health can't provide Georgians with the level of testing they deserve if they have to do it alone. Such extraordinary work requires all of us. State, public, and private entities must come together if we are going to win this fight against this disease. So today I'm especially pleased to welcome a new partner in this fight. As the governor has indicated, stepping up in a tremendous time of need, the Peach Bowl Incorporated has teamed with Governor Kemp and Augusta University to provide funding that will help us scale up the patient telehealth screening app to make COVID-19 screenings available statewide during a critical time in the mitigation of this disease. I want to thank Gary Stokin, CEO and President of the Peach Bowl and the Peach Bowl Incorporated for the generous donation, helping save Georgians across our state by providing improved access to COVID-19 screening. Through public-private partnerships like the one we've announced today with the Peach Bowl, our ability to augment Commissioner Toomey and the Department of Health in their mission to provide COVID-19 testing to all Georgians who need testing is dramatically enhanced. Governor Kemp, thank you once again for your leadership. We stand with you in this very important and life-saving effort. We're all in this together, and together we will win this fight. Thank you, sir.
Well, thank you, Mr. President, and I hope you will pass along our gratitude to all those folks that are working very hard down there in the call center and the medical professionals and the folks that are helping with the testing. We're very grateful, along with all of our frontline healthcare workers. I want to turn it over real quick to our Insurance and Fire Safety Commissioner, General John King. General King, he's part of our coronavirus.
And that is the latest COVID-19 update from the Capitol in Atlanta. Governor Brian Kemp and other officials there giving us a little handle on what's going on as of today. So one of the hugest things to come out of here is that there is more testing capacity and there are more kits available for folks to be tested. So they have changed some of their policy for the time being, and that sounds like anyone who wants a test now, regardless of symptoms, will be able to get that test. Maybe you've been in contact with someone who was sick or had COVID-19 and you just want to know for sure before you are showing any symptoms. It sounds like the health departments have been directed to now allow those folks to get tested. It does still sound like you do need to go through your health care provider.